first thing we'll point out from my pictures is that dental issues don't look the same in cats as they do in people. So my picture here is that, here's a cat, which I know that is a fake smile. You've probably seen this picture before of the cat looking like it's smiling with its mouth closed. And then a person, obviously broadly smiling. I'm not sure where the picture was from. I would guess it was from a dental ad for some dentist. And this person with their nice healthy teeth and gums, and the cat, I can't tell what their teeth and gums look like. And that's what a lot of people look at, you know, out of sight, out of mind. I'm looking at my cat and the mouth is closed. I can't smell anything from where I am. Seems fine to me, and so that's how a lot of people proceed, is that cat looks great, probably feels great. I'm not going to worry about it. The next thing on that is that their mouths look different than even dogs. If we were to say, well, you know, maybe we should look at how we look at dogs. Most dogs, I could be in an exam room with them, and even if they're a fear biter or an aggressive biter, and I have to muzzle them for some of my procedures, I still get a decent look in the mouth during the course of my exam, that I will take off the muzzle after doing the vaccinations. I'm talking to the owner, we're pretty relaxed, the bad stuff's over, and I can see the mouth and the dog's kind of waiting for the next treat. I get a decent view, I get a decent smell, especially if the dog's taller and is looking up at me. I can tell a lot from that. With a cat, unless I'm intentionally looking, if that's how they're holding their mouth, again, out of sight, out of mind, and that's the same for the owners too. And then the last point on that, why we don't recognize it, is that for the cats, if in the animal kingdom, if you're not the predator, you're a prey. And you may have seen this with your own cats before, that when you take them to the veterinarian, something could be terribly wrong, and they do not let on that something's wrong. I saw a cat just last week that the cat was 100% blocked. There was no way any urine was coming out of the urethra on its own without medical intervention. The cat ended up getting surgical intervention later this week. But this cat could not urinate. And in the household environment, it may have vocalized in the house. The owner didn't say that that was occurring. But in our environment, big scary person that I am from the cat's perspective, the cat crawled around the examination table, looked a little uncomfortable with his oversized bladder, got into the sink, squatted, very clearly was trying to pee, did not vocalize, kind of gave up on peeing and curled up in the sink to take a nap is what it looked like. But again, they have to keep up that front, like, oh yeah, I'm fine, I'm good. And so they're the worst patients in the world from that perspective as far as letting on that something is bad. We see lots of cats with dental disease that it's